Hi, it's Dr. Melinda Mann, OBGYN and lifestyle medicine. There was a comment that came on my feed about a woman in her middle 40s who has a history of PCOS, which is polycystic ovaries, and apparently she also has some sort of a tumor that needs to be removed, and there was some discussion about removing her uterus. Her question was, what should she do after the operation? First of all, a little bit about polycystic ovaries. It is a very common and getting even more common problem. It's an expression of a metabolic dysfunction in that the woman is not ovulating regularly, if at all. And it's considered to be a disease of insulin resistance. It's considered to be chronic and have an underlying mechanism, possibly of mitochondrial dysfunction, which are the little energy storehouses in our cell. It's very complex, and often women have difficulty becoming pregnant. They wind up using metformin, which is an insulin sensitizer, and they also wind up quite often taking fertility drugs. But this particular question is interesting because this woman is past her childbearing years. She's been suffering with PCOS, presumably for many years, and she wants to know how to approach PCOS in the middle 40s. And the answer is quite simple. You need a doctor who is familiar with lifestyle medicine. You need to check different markers. Are you pre-diabetic? How's your blood pressure? How's your cholesterol? What's your fasting insulin level? Are you having fat in your liver? How's the lining of your uterus? This woman may have her uterus removed, but are you showing signs of chronic stimulation of the lining of the uterus? Due to the lack of ovulation, the uterine lining does not shed properly. There are many manifestations of this insulin resistance syndrome, or what they were also calling syndrome X or metabolic syndrome. It's all the same exact thing. And the answer is lifestyle medicine. Diet/nutrition, physical activity, sleeping, stress reduction, avoidance of risky substances, creation of community/meaningful relationships. That is the approach. It's not a drug, it's not a pill, it's not a procedure. It's lifestyle medicine. So my advice to this individual is, if you anticipate after surgery that you might actually go into menopause, or even if you don't go into menopause, if they leave your ovaries, it's still exactly the same treatment. I'm reminded of a very old-fashioned treatment that they used to use for polycystic ovaries before it was, let's say, before we had a more sophisticated understanding of it. What are polycystic ovaries? Well, what happens is that the ovary is trying to ovulate, and it's struggling because the hormones do not cycle properly. So the ovary has multiple little follicles, which are little cysts associated with a little egg trying to get mature enough to pop out of the ovary and have a chance at getting fertilized. So these eggs are failed attempts. They never make it to the stage where they could pop out of the ovary and be taken up by the fallopian tube. And that's why it's called polycystic. So when you look on a sonogram, you see small cysts, many cysts. And there can be so many of them that when you look with a sonogram, there's something called a string of pearls appearance, where the periphery of the ovary is just so chock full of these little cysts that it actually looks like a string of pearls. And that's the classic sign of a polycystic ovary. So in the old days, really the old days, they had something called ovarian drilling. What they would do is they would operate on a woman. Very frequently, these women were so advanced in their PCOS situation that they were becoming hirsute. They had excess body hair, especially excess facial hair, or maybe even male pattern balding. And they would take these poor women into the operating room and literally drill holes and pop all of these cysts, because they wanted to give the ovary a chance to kind of reboot or restart in a proper way. And they would do the so-called ovarian drilling, or they would do something called a wedge resection, which is another surgical approach to treating PCOS. They would actually go and cut out part of the ovary, because the amount of hormones that were being secreted inappropriately by the ovary was so excessive that if they couldn't get it under control with medication, they would resort to these surgical approaches. And that's been long abandoned. But the point being, it demonstrates that women with PCOS, they're not well. Their ovaries are not functional. And again, the mainstay of therapy is lifestyle medicine. Now, there is one supplement that I've seen that's been helpful, and I'm using a brand name. It's called Ovasitol, and this is myo-inositol, which again is an insulin sensitizer. It makes the body more sensitive to insulin. I'm not going to get into that now, but I have found women using this Ovasitol have seen improvements. They start to cycle better, and some of them have achieved pregnancies. So I do sometimes recommend Ovasitol. I first heard about it quite a few years ago, but then I was watching some videos out of Boston where they have state-of-the-art infertility services, and they had great success with this particular brand, claiming that there are different isomers or different formations of myo-inositol, and the ratio that it occurs naturally in the human body is the same ratio that they're using in the Ovasitol. So I started giving that to my patients. Now, what in the world is myo-inositol? Well, actually, it comes from food. If you look up myo-inositol in Dr. Google, you will learn that you can get that from almonds and cantaloupe and other types of whole foods. So again, we're circling back to the same concept, which is lifestyle medicine is a treatment for these chronic diseases that don't really have a great pill or procedure. And lastly, I would just like to relate one story of a patient that I had with polycystic ovaries. It was a couple that had been married a little more than a year, and nothing was happening. And she obviously had a body type, what we call an apple. There's apples and pears. Pears are the hippier women. They're sort of wider on the bottom, and those women, generally speaking, I'm speaking in generalities, you tend to see less of the PCOS. And then you have women who are the so-called apple-shaped. They're more rounded, less hippie, and those are the women that you would think are more inclined towards the PCOS. And again, I'm speaking in generalities. So this was one of these apple-shaped girls, and she had really done a lot. She wanted to conceive naturally. So she came to me, and we were working very hard on the lifestyle issues, but she didn't conceive. And I guess we sort of maxed out. So I told her, listen, go to the fertility doctor, and hopefully he'll be able to help you. So she went, and all of a sudden she was back in my office pregnant. And that was like a revolving door. Whoa, you were in and out. What in the world? She said, yeah, it worked the first try. And I said to myself, I don't know exactly what the doctor gave her. The point being, I think that we optimized her through lifestyle so that she became more receptive to these treatments. Sometimes women go to fertility doctors and they're there a very, very long time until finally they achieve a pregnancy. It's my theory, and I'm sure it's evidence-based to say that if you optimize your health before you go in for fertility treatment, it makes sense that you shouldn't be in their office very, very long compared to someone who's walking in there completely metabolically deranged and a big mess. I apologize if you heard that story before, but it's such a remarkable story that I wanted to give it over. So to circle back and address this woman in her middle 40s who might be losing her pelvic organs now, the answer is you're not going to do anything that much differently. If you start to have menopause symptoms, we will address those. We can address those. Your physician can address those. But in terms of your metabolic dysfunction related to the PCOS, it's just lifestyle medicine. Thank you.